Hello everyone, welcome back to my channel. Today we are going to talk about an interesting entity or sign that is called T2 FLAIR mismatch sign in glioma imaging. So as we all know, in new era of radiogenomics, anything from imaging point of view that can help us to guess about molecular profile of the tumors is going to be a great help, because first of all it's not invasive and we can get some very valuable information, because nowadays molecular imaging that just dictate what type of treatment we are going to have and what type of prognosis these tumors might have. So let's dive into this imaging that I'm just going to explain the T2 FLAIR mismatch sign here. So as we see here, this is the image that is labeled A is a T2 sequence, and we know this T2 because you see the CSF is all bright. So we see a lesion in the left temporal lobe that is like very T2 bright. The image that is labeled B is a FLAIR sequence, and we see that this T2 signal that we've been seeing mostly is just fading inside, and then we see that this is just dark inside, and we see a rim of like hyperintensity around it. So basically there's a T2 bright, but in that region we mainly have dark signal on the FLAIR, and then we have a rim of hyperintensity around. Image C is a post-contrast sequence that we see that the whole lesion basically not enhancing. And the way I know this is post-contrast, because we see all these vessels at the skull base, and we see these oral venous sinuses. So this is a post-contrast sequence, and we see the lesion is not enhancing at all. So it's a very good sign actually. And then this is the ADC map, DWI and ADC. Here we have ADC map that shows the lesion doesn't have any restricted diffusion, is all bright. So basically we have a lesion that is not enhancing and doesn't have restricted diffusion. And like basically based on these two sequences that they don't have enhancement and they don't have restricted diffusion, I can say, okay, this is going to be a good tumor, because when we have like lower restricted diffusion, it means we have low cellularity in the tumor, and when it doesn't enhance, it means that we have less blood-brain barrier disruption. So basically here what it means about T2 FLAIR mismatch. So basically T2 bright, and on the FLAIR is just dropping the signal out. So the T2 FLAIR mismatch sign is a very specific sign for a specific type of gliomas that are more low grade, and they are called IDH mutant 1p19q codeletion. And this type of tumors, basically this sign is 100% specific for this type of tumor. And when we know that the patient has IDH mutant tumor with this kind of molecular profile, it has a good prognosis, and then we know, okay, this is going to be more lower grade compared to glioblastoma that they are higher grade, or compared to the IDH wild type, and they are going to have better prognosis, and they are just going to have a like targeted treatment related on that molecular profile. Very interesting entity. So when you are doing your tumor imaging, you need to look at all these imaging characteristics: T2 FLAIR, post-contrast, DWI ADC sequence, and one important sequence also perfusion imaging, which helps you a lot in order to understand is a high-grade glioma or is a low-grade. Usually low-grade tumors, they have lower perfusion profile as well. So basically T2 FLAIR mismatch, IDH mutant, 1p Q19 codeletion, remember that. And then I put the reference of this article as well. If you want to just go and learn more about it, there is a reference article down in this video. Thank you, and if you enjoyed watching this, please subscribe and keep following us. Thank you.